Welcome to RUMC Connections. Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined today by infectious disease doctor Jessie Saverimuttu and our lovely volunteer, Daria McGill. Through RUMC Connections, you'll meet the fantastic doctors, nurses, and medical professionals that make our hospital thrive. We'll provide you with some useful information about your own health, explore the latest medical news, and hopefully get you answers to some of your own health-related questions. So today we are tackling an issue that becomes especially relevant during the warmer months, which is tick and Lyme disease. So joining me today is Dr. Jessie. She is an infectious disease specialist at RUMC and brings years of experience treating and educating patients about a wide range of infectious diseases. So today she's going to help us separate fact from fear when it comes to tick bites, Lyme disease, and how to protect yourself and your loved ones. From early symptoms and proper tick removal to prevention tips and treatment options, we've got you covered on everything you need to know to stay safe this season. So whether you're hiking in the woods, spending time in your backyard, or just curious about infectious diseases and how they spread, then this episode is for you. So Dr. Jessie, as I mentioned, is an infectious disease specialist, and she serves as the clinical chair of the Infection Control Committee and the chief of quality improvement for the Department of Medicine, overseeing the medical residents in quality and patient safety. She is board certified in internal medicine and infectious diseases and has been an attending physician at RUMC for the past 15 years and one of the warmest and sweetest doctors that I know at RUMC. So thank you for finally being my guest.
Thank you, Meredith.
Of course. And RUMC is a teaching hospital, and aside from being a teaching hospital, we're also really proud to offer volunteer opportunities, which is where Daria comes in.
Yes, I am. I volunteer at RUMC, and it's been one of the most amazing experiences that I've had. It really combines the crossroads of medicine, administration, and public health in the most perfect way. And I volunteer with Meredith, Alex, and Cheryl, and it's been such a joy to meet the different doctors, meet all the people that keep the hospital running, and it is a pleasure to be here today.
So let's dive into things. Can you tell us a bit about your background and what led you to specialize in infectious diseases?
Yes, I'm originally from Sri Lanka, and then I came to the U.S., been here nearly 28 years. Why am I interested and why was I interested in infectious diseases? I've been always fascinated by microbes. Thing is, this is a warfare. Humanity fighting humanity is a no-no. But this warfare is against microbes that are so lethal, we have the armamentarium to fight them and win this war. So I really like to be in the front line, serving this war and feeling that I won.
That's wonderful. I love that. I love your passion.
Thank you.
Wonderful. So, what would you say are some of the most common infectious diseases that you see right now in our community?
Truth be said, thank God we are not seeing much of any infectious diseases.
That's good.
Like COVID is way down.
Yeah.
Influenza is way down. And even West Nile, we haven't seen that much. So we don't have like an outburst of infectious disease.
That's a good thing.
Yeah,
always.
it's a good thing.
Yes.
It's a good thing.
May it always stay that way.
Yes. But wait till the cooler months come in, then it's a different story.
Yeah.
And school starts up.
Yes.
Oh, boy.
Exactly. Okay, so what would you say defines an infectious disease?
Infectious disease is a disease that is caused by a germ.
Okay.
In medical terminology, it's a pathogen. There are several of them, but you can put them in different categories. Viruses, bacteria, fungi, parasites, protozoa. These are the main categories. And what we see here in the US being most prevalent are the viruses and the bacteria and fungi. Parasites in countries that are developing, you do get the parasitic infections, especially the worm infestations and so on. But we do see some of those here in the U.S. down south.
Okay.
It is prevalent there. So I must give you some anecdotal features about what I do.
Yeah.
I'm an infectious disease specialist, mostly serving the hospital infections. So infectious diseases could be categorized as infectious diseases. That's my own terminology.
Yeah.
And the non-infectious infectious diseases. Say, for instance, a person has a urinary tract infection, and I sit next to the person during, my travels, sit in the bus next to the person. I'm not going to catch that urinary tract infection from that person.
Yeah.
But take the opposite scenario where there is someone coughing and sneezing and the person has influenza and I'm sitting there, looking all around and inhaling those particles. I'm sure I'm going to come down with it, especially if my immune system is not that great. So there is a great big difference between infectious diseases and the non-infectious infectious diseases. And when I go into the hospital setting and I see patients, some of them, when I introduce myself as an infectious disease specialist, the first thing is, oh, no, I don't have an infectious disease. I say, yes, you don't have an infectious disease. I understand. I am an antibiotic doctor. You have a simple urinary tract infection. Oh, okay. This is the response I get. So I want the public to understand there are different categories of infections.
Of course. That makes sense. So what would you say are the peak infectious diseases for the summer months?
We should all know about tick-borne diseases and also the mosquito-borne West Nile virus disease because the climate change and the summers are being very hot and these particular pathogens are so highly prevalent during these times of the year. So we would focus on those types of infections that are transmitted by these insects.
Now, why do some ticks have Lyme disease and others don't, would you say?
It's the propensity of the individual tick. So for us to know what are the ticks, because not all ticks can get these pathogens to survive in them. Some ticks have the particular propensity to harbor them and to allow them to live their life cycle there. Not the entire life cycle, at least part of it. So basically, the ticks that carry Lyme disease, which is very prevalent in Staten Island and in the North Bronx, and I must tell whoever's listening, just you can visit nyc.org or the CDC and you get a lot of information. Whole lot of information which is very useful. Yeah. So in North Bronx and Staten Island, it's highly prevalent. So the tick, which is a very ugly looking tick, and it could be the size of a poppy seed or a sesame seed, but this has black legs and a black mantle. There are 8 legs, 4 on one side, 4 on the other side, and that's the tick that carries Lyme disease. But bear in mind, it is not only Lyme disease, which is a bacterial disease that it carries another bacterial disease, which is called anaplasmosis. Most of the people may not have heard about it, but that it carries that as well. And a parasitic pathogen, which is called Babesia, which also lots of people do come down with.
Wow.
Yes. And the last one that it carries, so it's carrying 4 different pathogens.
Oh, I never knew this.
Yeah, Powassan virus. In the North Bronx, there have been a few cases of Powassan virus. So these are the 4 pathogens that this nasty Ixodes tick carries.
Wow.
Yes.
Now, do these other viruses that they carry outside of Lyme, do people exhibit the same symptoms or do they cause different
Yes.
symptoms?
Unfortunately, it's kind of similar. So Lyme disease, there are stages, but the initial stage, it'll be like fever, headache, joint pains, muscle pain. So it's like a flu-like symptom. So all of them do show that.
Okay.
But Lyme disease could kind of sometimes be self-limiting and disappear. It won't clearly disappear. You have to really have the treatment. But to distinguish it from the others, the person would continue to have fevers that will not go away unless you're treated.
Okay. When would you say tick season is at its peak here? Is it now?
Yeah. So it starts somewhere in, say, April and goes on to September. The peak months would be like starting from Memorial Day up until end of July. So we still have a few more weeks of July.
Oh, really? So
Yes.
August, it's not as much of a risk?
Yeah, there's a wane, but still, you should not put your guards down because up until late fall, as long as the heat is there,
then
it's going to be. If it falls below freezing, then they don't survive after that. So we don't know when our winter is going to set in, but we don't want to shovel snow either.
No.
But, that's what it is.
How does, Lyme disease develop once someone is bitten? Is there always that telltale ring? Is it
I wish there was always that telltale ring, and I wish that telltale ring is obvious in everyone, but that is not reality. So you could be bit by a tick and you would probably not even know it, So if you do get that lesion, which is called the bullseye lesion or the target lesion, you see it and that is the classic one.
Yeah.
But it doesn't have to be classic like that. Sometimes it is just a red rash.
Mm-hmm.
And when that happens, you could think, okay, I did get bit, I suppose, and I have this. And that's called the erythema chronicum migrans lesion. But in fair-skinned people, it's kind of obvious. Okay. But if you're dark-skinned, you may miss it. So you will never know that you got bit. That's the unfortunate thing.
Okay.
What are the concerns if you wait too long to diagnose Lyme disease, especially within treatment and chronic symptom?
Yeah. To answer that question, I'll break it down into the different stages of the disease. Okay. The early localized disease is when you get that lesion.
Okay.
You see that lesion, obviously. The early disseminated is when they feel the fever, the myalgias, the arthralgias. When I say arthralgias, it's the joint pains. Myalgias is the muscle pains. Then some of them do get like a typical finding of a nerve getting affected, which is the facial nerve.
Oh, really?
One side of the face won't move. You can't close your eyes.
Wow.
You can't pucker your lips. And when you drink, it just drools out of that
Like
side.
a Bell's palsy.
It is exactly Bell's palsy.
It's Bell's palsy.
Seventh nerve palsy.
Wow.
And if someone comes, with sudden Bell's palsy, Lyme should be in the differential diagnosis. Yes. Then the other form is that it can affect the heart, Lyme myocarditis, and it causes heart blocks.
Really?
And actually, I had a patient who was 19 years old.
Oh, wow.
Yes, and then the primary doctor was really astute and said, you have Lyme, and sent him to the CCU at RUMC, and he had like complete heart block. And so, my goodness, we started treatment and we looked at the monitor every day. It was normalizing. Eventually, it was all normal.
I had no idea it could impact the heart that way.
It does.
Wow.
It does. And then the latest stage, not the early, the latest stage is when they get arthritis. So it affects the joints.
Yeah.
So is the treatment always an antibiotic route for Lyme?
Yes,
Okay.
yes, absolutely yes.
Okay.
So usually doxycycline, but for those who cannot take doxycycline, you can give amoxicillin or cefuroxime, but those are the treatment options. But if it's very severe, like it has affected the brain, then you give IV ceftriaxone. And the treatment duration for that would be 21 to 28 days. But for early disseminated, you could go 14 days. So there are a few myths around, like you've got to treat longer, you've got to retreat. It's not necessary.
Okay.
Yes.
So how important is it to treat right away? Like, what is the window of the time frame that you need to really get these antibiotics going in your system before you suffer some of these consequences?
As
of
early as
Lyme?
possible, I would say, like within 72 hours, as early as possible is, what anyone would think. As soon as you know or see an ECM lesion, you start it off right away. But if you do see that you got bit and the tick is on your body for like more than 24 hours, because that's kind of the timeline where the bacteria gets into the system of the human, you could give a prophylactic dose of antibiotic instead of the whole length of the 14 days. Yeah.
Is it true, though, that some people live with Lyme disease for life?
That is a myth.
It's a myth. Okay.
Yes, that is something I would also like people to know.
Okay.
There is nothing called chronic Lyme disease. That terminology is there, but once treated appropriately, the bacteria should be killed.
Okay.
But that does not mean that some individuals do not manifest the symptoms for a long, long time. That is called post-treatment Lyme disease syndrome. That does not mean that the bacteria is there. So some people get treated over and over again, but that's not going to do any good. You may get the harm of having antibiotics in your system repeatedly. Okay? But bear in mind, if you do not take precautions, you could get bit by a tick again and get another episode of Lyme disease.
Okay.
And that could kind of confuse people.
Got it.
To this, I must also tell you that the antibodies that are produced for Lyme are not protecting you against another episode. So like other infectious diseases, if you get antibodies, that's going to protect you from the next time you get exposed.
Yes.
But this does not.
Okay.
And there are no vaccines yet.
Yes.
Okay.
Are there any concerns with resistance to any of the medication that's being given to Lyme disease? Or
And so far, no, and that's a good sign.
yes.
Okay. That's positive.
Yes.
So what would you say are some of the precautions that people can take when they're going outside hiking or just the kids are playing in the yard?
Yeah, that's important to know. So to answer that question, let's first see what the tick does before we tell what we have to do. So what does the tick do? Do they fly? No. Do they jump? No. They move by what is called questing. They move sideways like, crawling.
Like a crab?
Yeah, like a crab.
Okay.
You can picture them with their 8 legs crawling up.
Okay.
And when they crawl to like a few feet. They're not going to crawl right up to the top of a tree. So they wait in areas where there are high grass grown and if there's a lot of leaves collected. So they also like to be in cool places. So during the summer months, they'll be under trees where there's a lot of grass, with a lot of leaves that are collected. So knowing that and knowing the fact that they're not going to jump on you, they're not going to fly onto you like fleas, you take the precaution to say, I'm going to avoid where there's a lot of leaves collected which have not been raked and nobody has taken care of this area.
Okay.
If you're going hiking, stay on the trail because they are not going to come on any place that has no grass that is overgrowing. They will never come there. They will never jump onto you. So you keep that trail. And if you're going camping, you have to be sure that you're in a clear area. So even in houses, like, get your lawns cut.
Yeah.
And keep it trimmed. And make sure all those dead leaves are not gathered somewhere. You rake them all out and, make sure it's clean and nice. Then the ticks won't survive there.
Okay.
Right?
That makes sense. So do these tick repellents work, or are there any specific brands that you recommend if they do?
You have to use repellents.
Yeah.
And it will help to prevent them sticking on your body. I do not have any particular brands that I want to favor, but I have one thing to tell you. The EPA, the Environmental Protection Agency approved products are what anyone should use. So you could go online and check for EPA products for repellents and then choose what you want and use it because sometimes each family could have a different preference. And also, not that it's, very important, but sometimes there are allergies and you can get skin reactions to some of them. So be aware of that as well. And also, if you're using sunscreen, obviously you'll be using sunscreen. It's just kind of common sense to put the sunscreen first and then the repellent because you don't do it the opposite way.
Got it.
Okay?
What about if you find a tick on yourself or maybe a pet, your dog or something that's been outside? What should you do?
Yes. So first thing is to make sure you check your body. That is the only way you'll find it, or sometimes it's obvious.
Yeah.
So as soon as you get in, especially kids and pets, check them. And within 2 hours, just make sure you checked. And then also be aware what are the places in the body that it hides. Cooler places, moist places. So what are those places? Like it's the creases, right? It's the elbow crease, behind, the knees, the groins. If you have been uncovered and just moving around because it's very hot and you didn't cover yourself well enough, and then under the arms, under the breast, in the, the nape of the skin, where there's, and in the scalp sometimes, under the hair. So try to look at it. Sometimes it's so small that you won't even see it. But if you see it, then you know it's there. But take a wash, soap and water wash. It washes off a lot of times. But even with that, now you have identified this tick. What do you do? So I would advise everyone to have this fine tweezer, just a handy one at home.
Yeah.
And when you see the tick, you can see where the head is. Like the body is a little, bulky, and the head is the tiny part.
Yeah.
And this, where it actually injects this bacteria into the skin, is in the head part.
Okay.
So you take the tweezer, go vertically down, and just pull the head out with those mouth parts which carry these organisms because they are injecting it in. Pull it out And the whole tick should come out that way. Once the whole tick comes out, you know that there's nothing left there. If you are a little bit nervous or anxious about whether it is out or not, it's a little tricky. But when you see that, it's better for you to speak to your healthcare advisor, your primary care physician, and just get some advice from them. Okay. And also bear in mind, not every tick that you find is going to be a Ixodes, a Lyme disease tick.
Yeah.
There are so many different types of ticks.
Should people save the tick and bring it for testing to see if it has Lyme or?
That's usually not advised because it takes a very long time before they can test and give you the results, by which time you might as well have got the treatment and
shown symptoms,
Okay.
Yeah.
So if you have any tick on you, you should just take the precautionary methods and treat it as if there could potentially be Lyme.
Yeah, and if you can see the tick, if it's big, if it's the adult, it's really, you can see it. And with a magnifying glass, you see this black mantle and the black legs. It's most likely it's the Ixodes tick.
Okay.
But some of the other ticks, like there's the Lone Star tick, which has like a lone star on its back.
Oh, really?
Yes. So that one actually transmits ehrlichiosis. It's a different bacteria. Yes, that also we have here. And then also the dog ticks are there. They're different. So there are plenty of ticks, but don't be afraid that every one of them is carrying Lyme.
Okay.
Okay.
But they all kind of seem to carry some sort of bacterial
Most of them.
disease.
Some of them are just benign.
Okay.
Yeah, but also don't crush the tick
Okay.
with your fingers.
Okay.
Because then you might inoculate yourself with some
interesting.
mouth part that might stick in and, so be careful of that. Used to is all the time.
Okay. If it's not caught early, what would you say are some of the long-term complications that could occur?
Yeah. So as we said, it's most of the time, immediately. So 3 days to 30 days is where the early symptoms come in. And then after 30 days to weeks to months, you can get the long manifestations. The carditis is there, the neurolyme is there, and then the arthritis is kind of the final one. So sometimes if they have arthritis, like especially one joint, and it's very painful, it's swollen, it would be good to keep Lyme in the differential and then test, the serology and then treat, and it may help. But once the damage is done, it's a little difficult to get back to normalcy. But at least if you get the treatment,
It won't progress any further. Okay. Have you seen any new or emerging treatments for Lyme?
No, unfortunately not.
Okay.
And thank God, as you asked me, there's no
Yes.
resistance still, so we are still good.
So we're good with
Yes.
the
No
current
need to.
treatment. If parents have young children playing outside in the summer and they don't see the tick, they should just still look for the same symptoms.
Yes.
So, the lethargic or, fever, flu-like symptoms. And
That's correct. So
Okay.
prevention is better than cure. So the first step is check.
Yeah.
You don't find it, but still when they play and come indoors, make sure they have a good shower.
Yeah.
Okay, so that way you definitely can prevent this. Then despite what you do in terms of prevention, they still get it, then you treat.
Yeah.
Yeah.
Okay. You said that the landscaping would definitely help. Are there any other
Yes.
environmental measures that people could?
Not really. There's nothing much more. As we
Really?
said, how does this move? It's these long, tall grasses and,
Yeah.
So keep your lawns trim and nice.
Okay.
Yes. How come people continue to show symptoms even though they're technically not infected with Lyme disease?
Yeah. So there is a kind of thought processes on this as to why this could be, but really, I suppose more research is necessary. So what happens is the Lyme disease causes the infection and the inflammation associated. Inflammation is actually the body's response. The body has already started responding. We get rid of the pathogen, but the body still continues to respond. So the inflammation continues, but the infection is gone. Why do some people react this way? It's clearly unknown.
Interesting.
But most of the time, people don't react that way. So it's only a small population that reacts that way. So I'm sure this is given for any other condition, any other, infectious disease, like post-COVID.
Yeah, long COVID. Yeah.
The long COVID, exactly, yeah. So there must be something that each individual body has to say to this infection,
Okay. Definitely. Are there any other myths, about tick or Lyme disease that you'd like to bust today that you hear, people maybe worrying about or?
don't believe that you are chronically infected with Lyme.
Okay.
And if you feel that you're fatigued, you have joint pains, you have muscle pains, please make sure that you see your healthcare provider and that no other diagnosis is missed, like rheumatological diagnosis.
Yes.
Okay, because some people, anchor onto this Lyme and say, oh, I had Lyme, post-Lyme. No. Go and seek help so that some other sinister diagnosis is not missed.
Okay. Makes
Yeah,
sense.
because you often see on social media that it's proliferated, that people are, have Lyme disease and it's chronic and they have it for their whole lives.
Yeah,
and
that's
that's
why
something
I
I totally didn't know. I thought,
Yeah, and the post-treatment Lyme disease syndrome, it can persist from 6 months to an year. And hopefully they will get better with the passage of time. But again, bear in mind, you go to the woods and get bit again, then you might get another episode of true Lyme disease, and that might kind of perpetuate your inflammatory processes, and then you might get worse.
Okay.
Yeah.
What is one thing that you want every listener to remember when it comes to protecting themselves for tick-borne illnesses?
Just be aware of your surroundings, see where you're going, and it's on the deer most of the time, and these white-footed mice that may be running around. So try to avoid those areas, but don't curtail your life just because of a little bacteria. Enjoy your life, but take the precautions that we have already discussed.
Yeah. What about like the precautions of like wearing a hat or maybe like high socks or pants if you're going to be hiking through like a grassy wooded area if you're going off trail?
Yes, that is the advice.
That's the advice.
Wear
Okay.
as much as you can to cover your skin areas.
Okay.
But I know the heat and the humidity and wearing all these things
I know.
are just
Not ideal.
Fun,
It's
not
not
fun.
ideal. So use insect repellent wherever you think you're going to have your skin exposed. And if you can tolerate wearing those, that would be ideal.
Okay.
Yeah.
Are ticks more active at a particular time of day? Like, would you say if you're doing an early morning hike or like an evening hike, if it's not as hot, that they might be a little bit more active at certain times of the day?
That is not known, but only thing that is I found interesting was that if they sense a high amount of carbon dioxide, and they seem to be very intelligent.
yes,
Like if you pass
they are
by-
very smart.
Really?
Yeah. And if you pass by and they sense that there is extreme, like an increase in carbon dioxide, that's when they say, okay, here comes my host. And then
Oh. And so
they
they
move
try
from the grass.
to make their way to you.
Yes. So if lots of people are moving around at night and there's a lot of carbon dioxide, I suppose, it's interesting. At the same time, we don't have enough information. Yes.
Okay. I was not aware they were so intelligent.
Yes.
Okay. So thank you very much for these very useful tips and for busting some of these myths, because I certainly was not aware about
Thank you,
a lot of that
Meredith.
information.
Thank you,
And, that wraps up this episode for RUMC Connections. A big thank you to you, Dr. Jessie, for sharing your experience, and to you, Daria, for joining as well. You've really helped, us better understand the risks and I think the realities of ticks and Lyme disease. So as we head deeper into summer, remember that prevention is key. Wear that protective clothing, use the tick repellents, and check yourself and your loved ones after spending times outdoors. And do not hesitate to reach out to a healthcare provider if you do have concerns. And if you found today's episode helpful, please share it with a friend, subscribe to the podcast, and leave us a review. We'd love to hear from you. And thank you for listening. Stay safe out there, and we'll see you next time on RUMC Connections. Thank you.
Thank you, Ben.
Thank you.